pain has a purpose. We need pain. We don't want it, no one enjoys it, but without it, our bodies are left very vulnerable. Thank you. Thanks, Karen. How are you all doing? Well, we've all had lunch, so I'm hoping you've all stretched a bit. They always give me this slot, and I'm like, oh, everyone's just going to fall asleep. But hopefully, you're all just going to stay awake for the next couple of hours. And I am looking at pain management. Why? Because as part of my role as a nurse, we see about 2,000 people in the complex service in London, and they all have my direct line. So as you can imagine, all the different things that come across in this condition, and dealing with pain and how we manage pain is something that I'm speaking about every single day, because unfortunately it is one of the complications of this condition, and something that is not that well understood and can sometimes not be that well managed either. So firstly, what is pain? Good question. If we're talking about pain, what are some words that might come to you? Do you want to yell them out to me? If you were asked what is pain, what might you say? I can't hear anyone. Sore. Okay, yeah, sore. A sensation. Yeah, anything else? No, I heard one. Piercing, throbbing. Okay, so different words to describe maybe physical pain. Has anyone ever experienced grief? Yeah. Is that pain? Yeah. Is that painful? That's really painful. And I think that's why I like the International Association's description of pain, because when we're thinking about pain, as clinicians, we talk about total pain. So it isn't just this physical sensation. If I accidentally tread on some Lego, if anyone's ever done that, oh my goodness, woo, you get that pain response comes up. But what else? Suddenly my heart is racing. I might start feeling angry at the person who maybe they were little, so I shouldn't get too angry at them, who left it on the floor. I might start getting annoyed at other people for not cleaning up. I'm going to throw her in, my housemate decided that sewing in our living room with our really shaggy pile carpet was a good idea. One morning I was walking around my house barefoot, as you would expect to do in a house that is safe, and I suddenly got this very sharp pain in my foot, and of course instantly you're like, oh my goodness. So I get some fear response, and my heart starts racing, my blood pressure probably went up, hands start getting clammy as I look down. What was it? And it was this pin, and thankfully it hadn't gone that far in. So then obviously emotionally I was getting quite angry at her, and I was also getting this expectancy of quite a lot of damage, because the pain was so severe, but actually it was this tiny little poke and hadn't really done anything. But I think that's really important to remember when we're talking about pain, is that it's unpleasant, obviously no one likes it, of this emotional experience, because suddenly our body goes into this overdrive when we're in pain, with actual or potential tissue damage. So a lot of what I was experiencing, it wasn't actually, my foot was fine. It hadn't really been pierced that much. It was just like this little poke. But what I was experiencing was this feeling of a potential for tissue damage. And I think that's something that we really need to think about, is when we experience pain, sometimes it's about our fear of the potential damage rather than actually what is happening in our bodies. So quick question, who would like to live without pain? Anyone? Be quite nice, life without pain. Yeah, that would be good. We can just cruise on through. Oh, sorry. Okay. Sorry, live streaming. What's happening in 2019? Okay, so the reason I put this up is thanks to Dr. Pang, our pain specialist, for this photo. So this is a boy with pain insensitivity. So there is a condition that people can be born with where they don't experience pain. And the problem with that is that they don't live very long because, as you might be able to see, it's a bit hard, You know, he's lost a couple of fingers, he's got several burns. Why? Because pain has a purpose. We need pain. We don't want it, no one enjoys it, but without it, our bodies are left very vulnerable. And so what might be some of the purposes of pain? Can anyone think of any? A warning, telling you something's wrong. Anything else? Yeah, so, you know, we don't just have it for no reason. Pain is part of, you know, our evolutionary response to protect us. It's actually there for a good reason, because if we're in pain, that tells our body something's not right, something's going wrong, and you need to stop. So, you know, it protects us when an injury has occurred. You know, I put my foot on that pin, instantly I stopped. You know, if I kept going, we might have had a bit more damage than what happened. You know, instantly it tells you to stop. So, you know, it's telling us that something is wrong, you know, and also long-term experience and memory of pain helps us to avoid harmful situations in the future. So this is really important, especially as children, you know, as we're learning. You know, we might be exploring the kitchen and keep trying to put our hands on the oven when it's on, and our parents are saying, don't do that, you know, keeping us away, trying to keep us safe. But if we accidentally get through past our parents, you know, and you experience that burning sensation, it's really unpleasant, and that unpleasant response gets wired into our memory so that in theory, we shouldn't do it again. So it's really important to remember that when we go through pain, it is linked to our memory. And it's really important when we're looking at long-term pain management, is that we've got that memory of what that painful experience was. So there are different types of pain that we look at. The first one would be acute pain. So this is, you know, really short term. It usually has quite a clear cause. So for example, it might be that you fell over and you broke your ankle. So that would be acute pain. It has a clear cause. We will, you know, what would we do for a broken ankle? You might initially quickly, you know, put some ice on it, elevate it, go to A&E, get an x-ray, put a cast on. So you've got a very clear management plan, and then hopefully the bone fixes, you can go back to walking as normal. So that's acute pain. It's got a clear cause, clear way that we can manage it, and hopefully you can go back onto what you were doing before. Again, it's there, it's a warning, it's an alarm telling you there's a problem, we need to stop. You know, so it might be that, you know, if people have had to have their appendix out before, you know, appendicitis, you've got that really stabbing pain, and you go, oh, that's not normal, and you get it checked out. Again, hopefully they sort you before it ruptures. You have your surgery, heals, you're in pain for a bit, and then you go back to your normal day-to-day life. So acute pain, we usually say lasts about 3 months. Anything that is longer than that, we then class as chronic pain. So what might be some of the things that we would use to treat acute pain? So if you think about if you've ever had experience of acute pain, what sort of things might you have done? Paracetamol. You've taken some paracetamol? Yeah, so say if you're not someone having a migraine like what Dr. Ealing was talking about before, but it's just a one-off headache, take a bit of paracetamol, you're all good. Anything else? Antibiotics, yeah, so if you've got pain because of an infection, treat the infection, the pain will go away. Perfect. Anything else? The TENS machine, we'll get to TENS in a bit. Physiotherapy, yeah, so say I've busted my shoulder, got a bit of inflammation, you know, some physio, that would be really helpful. Fix it up, I'm back to using my shoulder like normal. So some things like, you know, if we've got a broken leg, what are we going to do? We're going to rest it, we might elevate it, we're going to strap it up so you can't use it. So that works really well in, you know, this acute pain phase. You're going to rest. You know, if you've got a burn, you're going to treat it with cold running water, aren't you? Might have to keep it bandaged for a bit, and then hopefully the skin recovers, we go back to life as normal. And what sort of pain medication might we use if we've got acute pain? You know, things like you mentioned paracetamol, ibuprofen. You know, if it's getting really bad, you've got your codeines. If you've had surgery, you might start putting on some morphine or something like that. All those kind of ones for short-term pain relief. But if we've done our short-term pain relief and it isn't something that's going away, we then class this as chronic pain. And the difference between the two is that some of the things we use for acute pain, actually, they don't work if your pain is going on for a long time, and sometimes they can lead to other problems. So, you know, we treat chronic pain as a disease in its own right. You know, that's why we have pain specialists. You know, they have their own label, you know, your own different specialists that you go and see. And it can sometimes be something that can't be easily explained. So sometimes, you know, you'll have pain, you'll go through all these different tests and things like that, and we can't test for pain. It is an experience that you're experiencing, rather than something that we can say, oh yes, you do this particular test and it tells us how much pain someone's in. We can't do something like that. Okay, I'm just going to quickly sidestep, because a lot of people with NF1 might experience pain because of a lump, so neurofibroma, as Dr. Ealing was talking about before. Sometimes these neurofibromas, because they're sitting around the covering of the nerves, they can be pressing on the nerves, irritating them, and that causes nerve pain. And if we're thinking about what sort of, you know, words we would use to describe nerve pain, I heard someone before, you know, it's that kind of sharp shooting electrical pain. And so, unfortunately, sometimes these lumps, you know, they can be operated on, sometimes. And sometimes that is the right thing to do, but with all surgery, there's a risk. And so, unfortunately, I have seen people who've gone for surgery and the pain has gotten worse afterwards, because there's now permanent nerve damage. Sometimes a lump's in an area that we really can't operate on. And so, as Dr. Ilian talked about, there isn't that much treatment options in that case. And so that's where we look more at management of pain rather than something that's curative. But just a word which Dr. Ilian mentioned as well, if a lump becomes very painful, is growing rapidly, changing texture or causing weakness or numbness, please get in touch with either your GP, your neurologist. If you are under one of the complex services, please call us. Like, these are the things that we want to know about ASAP. So back into chronic pain. So we can't cure chronic pain, but we can try and reduce the impact of the pain on your day-to-day life. So if you're in pain, you know, it isn't just that one experience of the pain that you're getting. When we talk about total pain, we're talking about, you know, as Dr. Illing said, it might be impacting your sleep. It might be impacting, you know, your ability to work. It might be impacting how you relate to your family. Maybe, you know, you can no longer pick your children up or something like that. And that's all going to impact on your experience of pain. And so that is something that we want to then look at, is that whole picture, not just what's going on in your body, but what does this mean for you in total as a whole person. And there's many ways that we can do that. So as part of, you know, our team in London, we've got lots of different professionals that we work with. And the reason we have lots of different professionals is because there isn't one simple solution that we can just slap onto every single person and it solves all their pain and it's great. We need to work as a team to manage something that is quite difficult to manage. And, you know, no one's going to come up to you and say, oh, that's fine, you know, we'll sort you out. Like, we have to be honest, you know, this is a complicated topic, and it's one that, you know, one size does not fit all, and it's where having a partnership with the team that you're working with is so important. You know, we want to be able to listen to you and what's working for you, what you've tried already, and come up with hopefully a solution that is going to be, you know, manageable for you and work with your lifestyle. So different ways that we can do it depends on the intensity of pain that you're experiencing and what the pain is doing to your quality of life. And there are different ways that we can go about it. So the first one before that I would encourage anyone who's experiencing pain is looking at different self-management options. So this is something you can do at home, you can do it online. A really helpful toolkit is the Pain Toolkit. It's a website that has, you know, different videos for different pain strategies that you can do at home. So it's a really great resource. And there's lots of other online resources that you can tap into that you don't need to see anyone about. You can just start, you know, looking through and seeing what might work for you. So medications. The medications that I mentioned before when we're treating acute pain, you know, they work well for acute pain, but after a while, and when we move into chronic pain, they're not very helpful, and in fact sometimes they can cause their own problems. So not wanting to throw anything out or people have to break confidentiality, but does anyone know what sort of problems you might get if you were on, say, morphine for a long time? You can get addicted to it, yeah. You build up a tolerance so it doesn't work as well in your body anymore. That's quite a big one. Anything else? Nope. It really affects your bowels, so people get quite constipated and that can cause its own problems. It affects your breathing, so you know it's quite dangerous if you already have, you know, breathing problems to be on things like opioids for a really long time. Things like codeine, again, affects your bowels. You build up a tolerance. And what can happen when you take these medications is that you can start getting a centralized pain response where you start developing pain all over your body, and that's quite difficult to treat. So these ones really aren't suggested for long-term use. Other medications, so things like paracetamol and ibuprofen, again, as Dr. Ealing mentioned before, you know, headaches are really common in the general population, but especially in the NF population. And analgesia overuse headache is something that we see a lot in clinic, which is if you're taking paracetamol or ibuprofen every day or codeine every day, you can actually cause yourself to have a headache, which obviously if that's what you're taking for a headache, you kind of get yourself into this cycle that's quite difficult to break. So really important when you're thinking about the type of pain that you have and you're speaking to, you know, your doctor, be it your GP, your neurologist, whatever, you know, that you're thinking about when they're talking about starting you on a medication for pain, is thinking to yourself, is this a short-term pain? And am I going to be on this medication for a short term? Or are we thinking this might be a long-term issue, in which case we need to think about the types of medications that we're going to use. So I don't know if anyone has tried any nerve-specific pain medication. Again, these can have varying side effects. I don't know if anyone, has anyone tried something like, you know, amitriptyline or gabapentin? I'm getting some nods. Yeah, pregabalin. So these are the ones that we use for nerve-specific pain. And can anyone think of any side effects you might get from them?
Memory issues.
Memory issues, yeah. Anything else? Weight gain. I know it's really not ideal. Weight gain, please no. Yeah, dry mouth. So yeah, constant. That's a big one. And feeling like a zombie. So, things like amitriptyline can make you sleep, but as like Dr. Ealing was saying before, you then still don't feel rested. And some people have told me they experience a lot of nightmares while on them as well, which is not ideal. So the medications, they're not great for this, and we want to be very careful when we're starting people on these types of medications. And I'll be honest, I've had people come back to me say, they tried one of these medications and started gaining weight and said, Mary, I've got to be honest, I'd prefer to have my headaches. And I was like, that's fine, that's your choice. And that comes back to this being a partnership and not one size fitting all. So we've got medications that we can think about, but there are lots of other strategies that don't require medication or can be used in combination with medications, try and keep the amount of medication you're taking to a minimum. And so one of them, someone mentioned it before, physiotherapy. We have a neurophysio in our team. Why? Because we know that if you're using your muscles, that sometimes you can help realign yourself. So if you're in pain and that's affecting how you're walking, you then might start causing other problems with your muscles and your skeleton because you're not walking properly. And so a neurophysio can give you the right exercises to help realign yourself to prevent further pain and damage elsewhere in your body. But we also know that if you are regularly exercising, your pain tolerance in your muscles increases. So you're almost giving yourself a painkiller just by doing particular exercises. But it's really important that if you haven't exercised for a long time, and you can imagine if you're got something that's painful, you don't want to move it because that's painful. And so we rest it. And as we saw before, if you've got an acute problem, you rest it, fine, go back to day-to-day life. If this problem's not going away, resting it for a long period of time isn't going to be very helpful because your muscles are getting a bit deconditioned. And so that means that when you do try and use it, it becomes more painful to try and do that activity. So it's really important, going and seeing a physio, whether it's local or through the complex service, that you're getting the right exercises to do. We want you to be safe because it can be very difficult to start getting back into an exercise routine. So that is one strategy. Psychology. We have 2 psychologists in our NF complex service. Why? Because having a long-term condition that has a very big deal of uncertainty to it is going to impact your quality of life. It might impact how you feel about getting a job. It might impact your confidence. It might, give you some anxiety or low mood. And having pain, constant pain, is very common for that to start affecting how you feel about yourself, how you feel about life, what you're able to do in your day-to-day. If you're not sleeping well, that, as any new parent would know, is going to really impact how you're feeling and your resilience. So it's really important, if you're having chronic pain, that you're seeing someone to talk about how you're coping. And this, when I first start suggesting to someone who has long-term pain, or, not just pain, but fatigue or itching, common things that are difficult to manage, often I'll get the response, oh, you just think it's all in my head. And I go, no, not at all. And it's hard to unpack that because we have this idea in society that if you're going to see someone who specialises in your thoughts and your mood and that sort of thing, it's because, we don't believe that these symptoms are real or something like that. And it's not that at all. Pain psychologists have done special training to look at the psychology of pain, what the impact of having pain every day does to someone, you know, but also addressing things like the fear of movement. If you remember, I mentioned before about how it goes into our memory. So if you believe, oh, if I move or if I exercise, that's going to cause me pain, so I'm not going to move. If that's something you believe, then working with the psychologist to kind of unpack that a bit and challenge it might mean that you then feel freer to engage with the physio to do the exercises that will help you. So it's kind of looking at different beliefs around fear and around pain, and what that is impacting on your day-to-day life. So I really recommend if you have access to psychology, either through through the complex services or through IAPT. You know, every area in the country has IAPT. It stands for Improving Access to Psychological Therapies. You Google that and you can self-refer. So you don't even need to go to your GP to put yourself on the waiting list to see someone about your mood. So where I work, but I know that around the country there are several of these pain management programs. So that is, you know, perhaps for people who've had pain for a really long time, it's impacting their quality of life. Medications really haven't touched it. Seeing a physio on and off hasn't touched it. These pain management programs get people to come for an intense period of time where they then see a pain doctor, a pain nurse, a pain physio, a pain psychologist, you know, and start to really unpack all this and help people manage pain. We're very fortunate that where I work we have our own pain management program, but I know that there are several others around the country as well. So I'm just going to touch on psychological strategies, because that, as part of my role, is one of our main ways of trying to manage pain, is how people experience it and what they believe about it. And different strategies that we would use is cognitive behaviour therapy. Has anyone heard of that one before? Getting some nods, yeah. CBT is quite a common one. A newer approach that's coming through is acceptance and commitment therapy. Has anyone heard of that one before? No, that's fine. So that's ACT, and then mindfulness. And I've got my little pictures down the bottom of Headspace and Calm. They're apps that you can get that have different types of mindfulness, which is, you know, different meditations that talk you through. I use Headspace all the time, mainly for sleeping. I find it really helpful. So what is the difference between these strategies and how can they help? Cognitive behaviour therapy basically says, you know, your thoughts are going to impact, I'm just going to switch to this one. So your thoughts over here, they're going to impact your behaviours, they're going to impact your emotions, how you feel, and they're also going to impact the physical sensation. So some people might say to me, oh, my pain is often worse at night. And that's really common. I don't know if anyone's experienced that before, where your pain's worse at night. And that's often because during the day, we've got a lot of other stuff coming in. We have a lot of different input coming at us. So that even though the pain is still there and the pain hasn't changed, you know, what's causing the pain, at night, we suddenly don't have all those other distractions. So even though the pain has been there the whole day going, hello, I'm in pain, telling your brain, there is pain here. You know, during the day, you might have people coming and chatting with you. You might have been going out into the sunshine if there's some sun. Or, you know, you might be at work and work's really stressful. So you don't have as much awareness towards your pain. But at night time, you don't have all those distractions. And so that's where suddenly this pathway to your brain saying there's pain here, there's nothing to distract you from it. And so that's where having, you know, something like CBT, which looks at your thoughts. So if you're lying there saying, oh my gosh, I have pain, I can't sleep, this pain must be getting worse, it must be something really scary. You know, if I believe that, so say I'm lying there and I'm having a thought, well, I'm going to go back to when I stepped on the pin. Let's use that as an example. So I stepped on the pin. So the thought that I might have had when I suddenly got that sharp shooting pain, I might have had a thought, oh my gosh, it's gone straight through my foot. Oh my goodness, oh my goodness. And so that is a really scary thought, right? So my emotion response suddenly goes to fear. And my fear response changes the physical sensation, so that it's not just the pain I'm experiencing a physical change in my body, because my adrenaline levels are going up, my heart starts racing, I start sweating, my blood pressure goes up. These are all things that I can't control. You know, if we're having a fear response, if we're getting anxious about something, all these other things that our body starts kicking in, you know, we don't have control over that, but that's our natural response. And so my behavior obviously was to stop, was to have a look, and once I looked and saw it was fine, all of that stopped. But if there wasn't something that I could suddenly look at, say I've got a pain in my back, you know, and I know that I have a lump there, I've got a neurofibroma in my back, and I'm suddenly getting back pain, if my thought is, it's my neurofibroma, it's growing, it's probably cancerous, I'm probably going to die, I'm going to start getting emotion? Really worried, I'm going to get really upset, I will probably be calling Mary 1,000 times on the phone, because I have her direct line. You know, my behavior is going to change, I might get really grumpy around people, I might find it difficult to sleep. The physical sensation, when we focus in on our pain, it will increase, because you're strengthening that pain pathway. And so what CBT is doing, obviously in that case, you know, go see your NFPS and we get a scan. Scan comes back, everything's fine, nothing's changed. But I'll say, but I still had all this pain, I don't understand. So if we can work on those thoughts to say, actually, when I get back pain, that just kind of comes and goes and isn't a big deal, and I know there's nothing going on there, then something that we could do, CBT would say, so cognitive behavior therapy would then look at that thought and say, okay, we can change that thought. So your brain, all your different thoughts that you believe, we can question those thoughts and we can change them. So the thought of, I've got back pain, something serious is going on. The cognitive behavior therapy approach would then be saying, okay, let's question this thought. Let's take it to court. You know, if you go to court, what's the evidence? Do I have any evidence? Well, no, I just had a scan and everything's fine. So the evidence for that thought is that actually there isn't anything going on there, so I can question that thought. So that is then sort of our cognitive behavior therapy model, if that makes sense. The other model that we've started using a lot is the acceptance and commitment therapy, and that talks about this idea called diffusion. So basically, when I have that thought, I've got back pain, something serious is going on, I am then fusing myself to that thought. And by doing that, that's when I start getting my heart racing, my blood pressure going up. I'm starting to get really anxious and I can't sleep because I'm so worried. And it kicks off this whole scenario. But if I can remove myself from that thought and see that that thought is just a thought, then it stops this whole situation of my blood pressure going up, my heart racing. And so simple strategies that you can use is, I would say, I notice I'm having a thought that my back pain is something really serious. So just by saying this is a thought is just a stream of words. I've instantly removed myself from it suddenly taking over and me getting really anxious. And I find this strategy really helpful, you know, if I'm sometimes walking home late at night and it's London, I live in a slightly dodgy area, you know, sometimes I'll get a thought that's like, oh, there's someone following me. There's never anyone. But you know, you get that thought and suddenly I'm like, I'm really anxious and I'm reaching for my key. I don't know what that's going to do, but it might help me. You know, and you start getting a bit panicky. And so what I'm trying to teach myself to do is suddenly going, I realize that I'm having a thought that there's someone following me. There is no one. but saying that instantly removing it removes and stops that body response, that panic response. And so some people find that acceptance and commitment therapy, if they've tried cognitive behavioural therapy before and haven't found it very helpful, that some people are finding acceptance and commitment therapy more helpful. And if you're interested, there's a great book that we recommend for anyone who's going to go on our pain management program. It is called The Happiness Trap by Dr. Russ Harris, I think. I bought it for myself, and then my housemate stole it, and she's found it really helpful. And it sort of explains all those different kind of strategies where we can sort of remove ourselves from these thoughts, if that makes sense. So the last technique that we use a lot, partly for pain management, but also it works for a lot of other symptoms that you're experiencing, including itchiness. Mindfulness is used a lot for people who have different conditions that cause itching or pain, or other sensations like pins and needles, because it tries to focus the awareness of your mind onto something else. So instead of focusing on the pain or whatever other sensation you're having, to focus on something, maybe it's your breath. So, you're focused on your breathing, or it might be, zoning in on, one of my friends who used to have panic attacks. If she felt that panic starting to rise, she would stop and get like a glass of water, and she'd just focus fully on that water, the coolness of the glass, what that coolness of her drinking it felt like, and just to try and again remove herself from those panicked thoughts. Like anything, it takes practice. So the first time you do it, it might feel really weird. It might be something where you haven't tried before, and so it kind of feels a bit hippy-dippy, and you're not so sure about it. Keep an open mind. It's not for everyone, but it can be really helpful. And the more you do it, the more you're training your body to get used to it, to slow down, to be present, and the more you're training your thoughts, to stop, to be fully focused. So we're actually going to go through a mindfulness exercise together. So try and get as comfortable as possible where you are sitting. And I would definitely recommend shutting your eyes so you don't think no one is staring at you. You don't have to feel awkward. Everyone's in the same boat. So I would recommend everyone just shutting your eyes, taking a couple of deep breaths. I know we've still had lunch sitting on us, so try not to fall asleep, but if you do fall asleep, that's okay. We won't judge. Let's give it a go. The first step is to become aware. So check that you are sitting with a relaxed but upright posture. And this process is easier if you close your eyes. So now bring your attention to your inner experience. Gently bring your awareness to what you are experiencing. Ask yourself, what am I experiencing now? Right at this moment. Gently draw your attention to any thoughts going through your mind. Try to watch and observe these thoughts. For example, you may say something to yourself like, "Oh, I'm having anxious thoughts." Or whatever the thoughts are for you. Whatever the thoughts are for you, try to accept them as just mental processes. Thoughts that are simply happening, without trying to change them or getting hooked into them. Draw your attention to any feelings that you are experiencing. Whatever these feelings are, even if they are unpleasant or uncomfortable. Perhaps saying to yourself something like, "Oh, I'm aware now that I feel sad or angry," or whatever the feeling is for you. Simply try to accept and acknowledge these feelings just as they are, without trying to change them. Now gently draw your attention to any sensations in your body. Scan your body and notice any sensations. Pleasant, unpleasant. Any sense of tension or discomfort. Just acknowledge these sensations without trying to change them. Perhaps saying to yourself, "That's interesting. I'm feeling a tightness in my shoulders," or whatever the sensation is for you. Just acknowledge these sensations without trying to change them. Now gently move your focus to your breathing. Really focus on your breath, the sensations of your breathing, the sensations of the breath from it enters your nose when you start to breathe in until you breathe out. Become aware of your breath traveling through your body, the sensations, the movements of your abdomen and chest. If your mind wanders from the breath, gently bring your attention back to the breath. Use your breath to anchor you in this present moment. Now expand your awareness to include your breath and a sense of your total body, all aspects of it. Notice that it is as if your whole body is being breathed, is breathing softly, gently. If any feelings or sensations of tension or discomfort emerge, imagine your breath moving in and around those sensations, accepting them and embracing them, gently exploring them without trying to change them. When their presence becomes less noticeable for you, gently and softly bring your awareness back to your total experience in the present moment, to your body, your thoughts, the environment. And slowly opening your eyes, sitting here in the present moment. Thank you.